Hello, ladies and gentlemen. I'm Joyce IRAKARAMA. It's my honor to share with you information about EHRs, health in electronic health records. Throughout this meeting, we are going to share the introduction to EHRs, description components of EHR that support direct clinical care, as well as associated benefits and issues. Then two components of EHR that support administrative processes and explanation of associated benefits and issues. Then the discussion of the importance of the integration of administrative and clinical areas for effective use of an EHR. Starting to the introduction of EHRs, according to Centers for Medicare and Medicaid Services to 2012, an electronic health record, EHR in short, is an electronic version of patient's medical history that is maintained by the provider over time and may include all of the key administrative clinical data relevant to that person's care and a particular provider, including demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology reports. From that, you can understand that it's a shift from paper medical history to an electronic or computerized system of keeping patients' records, health information and data that we might see their importance as well as associated issues in the following parts. Then that links us to the description of two components of EHRs that support direct clinical care and explanation of associated benefits and issues. The first one, we see the component that holds summary of patient's information and patient overall health. Starting from the summary of patient's information, these components contain important patient information, which is like contacts, demographics, insurance, health conditions, and the registration time and the number of the patient. This is beneficent because there is an alert to a health care provider whenever the prescription of medicine might cause allergies to that patient because of the system based on the medical history of the patients. Again, whenever the ID of the patient is entered into the system, the summary of the patient's medical conditions or history is seen, which provides a basis towards further taking care of the patient. The associated issues are increase in medical errors due to shortage of end-user training and poor designed system interface that might mix up information. This is to say that there might be some times of whether the system can fail the provider, then mix up information of different patients that might lead to errors in medical provision. The second component is patient overall health. These components hold patient information from all departments like laboratory, radiology, different physician and different healthcare facilities. This is very important in aiding in providing patients quality health care under team-based approach because it is possible that under an EHR that patient's information from all healthcare providers or healthcare facilities they have consulted can be gathered together under information sharing. Again, the patient's information can be accessed anywhere, which can aid in the case of emergency because smartphones, tablets are portable. This helps to increase the quality of healthcare as well as the safety of the patients. The associated issues are privacy and security concerns that might allies while sharing information from department or provider to provider. Again, this issue of privacy might prohibit the smoothness of sharing information. This means that some providers might want to consider or respect HIPAA, then they tend to be like reluctant toward sharing health information, or might take sometimes toward looking whether there might be the breach of HIPAA. Then third, we are going to the description of two components of an EHRs that support administrative processes and explanation of associated benefits and issues. The first component is physician schedule. You can schedule the healthcare providers electronically as well as monitoring the time it takes to complete the assigned tasks, plus viewing the time it takes to have all patients have that all that they need. This component is beneficial to administrative process because it helps to get information on how patients' needs are met, the waiting times, cancellations, as well as tracking the performance of physicians. The issues that can arise here are financial issues like acquisition, adoption, and implementation of the system. It takes time and resources to transition from a paper-based system to a computerized system. This requires money and staff to aid in the transitioning process. So the second component is billing and submitting claims. Because healthcare providers document or register patients' visit automatically, the administration gets a list of codes that support the billing activities as well as aiding in the follow-up of claims as well as addressing them. The benefit of these components is that it saves time and reduces work while checking documents during billing. Because the summary of services provided is provided by the platform, it's easy to follow the billing process due to sums are visible and insurance companies that are eligible to covering the patients. Again, the patient's complaints are made right away because they are seen as soon as they are presented. The associated issues are committing errors by mixing up co-payments and insurance reimbursement in the course of adoption to the process due to shortage of experience or lack of end-user training. Then fourth, we are going to discuss the importance of the integration of administrative and clinical areas for effective use of EHR. For the effective use of EHR, there must be an integration of administrative and clinical areas. This means that it's of a great importance that administrative and clinical areas combine their roles by being on the same page so that service provision, quality of healthcare services, and the efficiency of healthcare can be safeguarded. So the administrative area has to make sure that physicians' scheduling is not conflicting and the billing system is accurate to minimize claims. This goes by making sure that physicians pay attention to the protected health information as well as keeping accurate medical information of the patients. When administrative and clinical responsible individuals play their part as required, there will be no error issues, conflicting schedules, and complaints, as well as privacy breach issues, which will facilitate into the smoothness of workflow effectively and efficiently, plus aiding in the interoperability of information. Thank you very much. It was my pleasure to be with you.